So let's have a one-on-one tutoring session, and the topic today is going to be heparin-induced thrombocytopenia. So I want you to think of heparin-induced thrombocytopenia, or HIT, using the NCLEX clinical judgment model. Are you ready? Let's start. First, let's address what is heparin-induced thrombocytopenia, or HIT. So HIT is an immune reaction to heparin that causes platelet activation. Because of that platelet activation, the platelet count tends to fall down, but here is the most important part of this disease process. The major danger is thrombosis, not bleeding. So let's look at the first section, which is recognizing the clues or the cues. So remember, the only time we will consider that as HIT is that the patient is receiving heparin. So the first thing you really need to look for in the question is a patient receiving heparin who develops a significant drop in their platelet count, especially a decrease of at least 50% or more from baseline. The drop commonly begins about 5 to 10 days. So 5 to 10 days after starting heparin, although it may occur sooner in someone recently exposed to heparin. Also look for signs of new clot, such as unilateral leg swelling, chest pain, shortness of breaths, decreased peripheral circulation, or other evidence of thrombosis. Now, let's connect these findings. So let's look at our analyzing the cues. So remember, the patient is receiving heparin, the platelet count is dropping, and there may be evidence of new thrombosis. That combination should make you suspect heparin-induced thrombocytopenia. Now, do not miss the platelet count simply because the patient is not bleeding. What do we do then? Your priority concern is heparin-induced thrombocytopenia with risk for life-threatening thrombosis. NCLEX may try to make you focus on bleeding because the platelet count is low. Do not fall for that. Please don't fall for that. With heparin-induced thrombocytopenia, clot formation is the major complication. Now, let's go to generating solution. The patient needs the heparin stopped, and an alternative non-heparin anticoagulant would be considered. You also need to assess for existing thrombosis and continue monitoring the platelet count. What do we do next? This is it. Stop all heparin immediately. That includes heparin infusion, subcutaneous heparin, and even heparin flashes. Anticipate treatment with a non-heparin anticoagulant such as argatroban. That would be a potential treatment to replace heparin. Do not simply switch from unfractionated heparin to low molecular weight heparin. Our next thing is to determine whether all interventions are working. So evaluating outcomes. What tells us that the patient is improving? A couple of things, right? The platelet count begins to recover. There are no new thrombotic events, and symptoms associated with an existing clot do not worsen. So remember this for your NCLEX. Heparin plus falling platelet plus thrombosis risk means that there is heparin-induced thrombocytopenia. So the question right now is, what is your first priority action when the patient has heparin-induced thrombocytopenia? The best answer is stopping any form of heparin. So save this video and share this video with your classmates and friends. If you're new to this channel, if you're able to subscribe, it will help me with this channel and reaching out as many nursing students. Thank you.